the Advancing Energy Podcast, featuring topics and trends on precision power conversion, measurement, and control solutions.
Hi, I'm Andrew Huang, Director of Investor Relations at Advanced Energy. With me today is Connor Quinn, Senior Director of Marketing in our Medical Products Group. Thanks for joining us, Connor.
Thank you, Andrew. Very nice to be here. In my role at AE, I lead product and strategic marketing for our medical group. Came to Advanced Energy through our Artisan acquisition a number of years ago, and I've been with the combined organizations now for over 25 years.
Great. Can you start us off by talking about the most exciting innovations that are shaping the future of medical power supply technology?
Certainly. There's a number to choose from. Obviously, there's a lot going on in the medical imaging space and robotic surgery, but probably the one most exciting area for innovation today is in electrosurgery. And in electrosurgery, there's a number of therapies being administered to patients through the use of RF techniques, pulsed power, pulsed energy techniques. And these are used for various types of treatments, for treating heart conditions, and even for oncology, for cancer treatment.
And why are these innovations exciting for Advanced Energy?
Yeah, they're exciting for a number of reasons. First of all, it allows us to leverage our collective expertise and knowledge over the years in the area of both AC/DC and DC/DC power supplies and converters. So for example, in AC, we're leveraging past technology and developing new techniques to introduce our cardiac floating power supplies, or CF rated as they're commonly known. In the DC/DC space, we can leverage both our low voltage and high voltage technologies and combine them for the applications in the medical space. And probably even more exciting, we can take technologies, products that we've developed outside of medical and now leverage and transfer that technology and knowledge inside the medical product group and deliver solutions to our customers. That might be in the area of RF control of plasma or in the usage of high voltage pulsing to deliver energy to the patient.
How is the shift towards miniaturization impacting power supply design in medical devices?
Yeah, it's a very important factor, not just for the power supplies, but for the customers' devices and the medical equipment. And for our customers, it can enable, and their users, it can enable a lot of things. Portability is a big one today. So for example, if the power supply can be miniaturized, if the medical device or piece of equipment can be miniaturized, the product can be moved from room to room, for example, and increase utilization. It also improves the experience of the user, maybe with a handheld device. If you can make it smaller, then it's a lot easier to manipulate and a lot easier to use. And it certainly facilitates the use of medical equipment in a home healthcare environment where space might be limited. In a clinical setting or in a hospital setting, you can imagine how crowded a surgical theater gets, for example. So shrinking the footprint of the electronic equipment that's in that room, and we certainly enable that, just allows for more effective utilization of space. The operators are more comfortable and ultimately leads to improved outcomes and safety for the patient.
What role does battery backup play in next generation medical equipment?
Yeah, that question kind of is related to the previous question. Traditionally, some of the equipment that was battery backed up by battery was larger and stationary. So the backup was for the purpose of riding through power outages, keeping the equipment running and keeping the patient safe during a power outage. As we've miniaturized, equipment has become more portable. So for example, when a patient and equipment is being moved from room to room, you may not want to power down the equipment, you may want to keep it energized. Of course, you have to unplug it from the wall when you're doing that, but the battery backup allows that equipment to continue to running. So that's really important.
How are evolving safety standards like IEC 60601 influencing power supply design?
You use the term evolving. I would use the term ever changing, because they're constantly moving, and sometimes fast. It certainly changes the way that we think of safety certification and product design over time. Most of the standards in the past were very prescriptive. They kind of told you what to do, what not to do, whereas the newer standards or the updates to the standards are more hazard-based. So they want the designers and the users to think through the hazards that might occur if a fault occurs. So that's really changed the way we think about it. On top of that, power supplies are becoming much more complex. So now we have to consider not just the hardware, but also the software and the firmware. So we layer in other requirements on top of that. For example, there might be life cycle requirements that we have to manage through other IEC processes. Quality management systems come into play for consideration of risk and how to consider and manage the risk, and that layers in another layer of complexity.
Are there other regulatory bodies to consider?
Yeah, certainly. FDA, for example, in the US regulates most medical device and medical equipment on the market. And the FDA, of course, has its peers in other geographical regions. In Europe, for example, the CE mark is really important, and the CE mark is used to enforce and ensure that various standards are being met by the products that are shipped into Europe. Kind of an interesting example there, and a new standard that's emerging is the applications of cybersecurity for connected devices. And many of our medical devices are certainly connected devices. So the CE mark going forward will be considering cybersecurity, and cybersecurity standards must be met.
What challenges do manufacturers face in an increasingly stringent safety and regulatory requirements?
I think the biggest challenge is just staying on top of all of the different standards that are out there. And like I said, these ever-changing standards. We as a company invest heavily to make sure that we can stay on top of that, and hopefully our customers can leverage our expertise there. One of the ways that we can provide services to our customers, for example, is through our customer experience centers, or CEC. So some of these standards, for example, mandate certain levels of EMC compliance or electromagnetic compatibility compliance, and we have the equipment and we have the knowledge and the know-how to test EMC performance, not just of the power supply, but of the system with our power supply in it.
In what ways is AI influencing the development of medical power systems?
In many ways, but I think probably the most obvious to our end users and to our customers is the increasing use of AI in imaging and diagnostic equipment. We're now seeing some of that equipment implement AI through the use of GPUs, adding to the power demand that would have traditionally been in those systems from CPUs. So it increases the power levels and demand of the entire system. I think there's another area where you could consider that AI is also being considered for design of the power supplies themselves, and many tools are now coming on the market to help designers in that regard. There is some debate about how fast those should be adopted and are being adopted. So that's an evolving landscape.
To close, maybe you could give us some of the key takeaways from our discussion today.
Sure. I think there's probably three key takeaways from it. I mean, the first is that the medical space is a hugely exciting one to be in today. The rate of innovation in electrosurgery in particular is very high, with more and more applications being developed in that space. With our customers looking for that technology, they're looking for brand new solutions. So it's not just evolutionary, they're looking for step changes and products and technologies that we don't have and that they haven't had before. And we're in a unique position in AE to address that. So I'd say that's the third one. We can combine our past expertise in the medical domain, in the medical space, and we can complement that by leveraging technologies and capability that we have in our adjacent markets.
Thanks, Connor.
Thank you, Andrew.
And thanks, everyone. Be sure to like and subscribe to our channel. Bye.
Thank you for joining us for this episode of the Advancing Energy Podcast. Be sure to subscribe.